Hello, ma'am.
Yes.
Ma'am, it's 7, ma'am. Shall we begin the session?
Yeah, sure.
Learning is the beginning of wealth. Learning is the beginning of health. Learning is the beginning of spirituality. Having a heart to start learn is where the miracle process all begins. Good evening, everyone. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj and Memorial Free Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College, Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discussing about interpretation and clinical utility of mesmerizing concept Gata Vata with an illustration of a case report by Dr. Saujanya ma'am.
Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disturbance, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any question can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Next, I would like to invite Dr. Neetu K.S. Ma'am, Assistant Professor, Department of Kaya Chikitsa, Ayurveda College, Coimbatore, to deliver the welcome address.
Thank you, Divyalakshmi. Good evening, one and all. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, it gives me an immense pleasure to extend a warm welcome to today's speaker, Dr. Saujanya, to detail into the clinical utility of Gata Vata concept. Welcome, Doctor. Welcome to today's session. And once again, let me proudly welcome all the delegates who have joined with us today. Welcome you all. Thank you.
Thank you, ma'am. It's a great pleasure for me to introduce our chief guest, Dr. Saujanya. Ma'am is currently working as Assistant Professor, Department of Kaya Chikitsa at STM Institute of Ayurveda and Hospital, Bangalore. We are extremely privileged to have you here in this platform, ma'am. Now, without any further ado, we will turn the time over to respected Dr. Saujanya, ma'am, to enlighten our minds with her knowledge. Over to you, ma'am.
Good evening, all. Thank you for the warm welcome, and I'm really sorry for not getting PPT here due to some technical issues. Directly moving into the topic, not wasting the time. The concept Gata Vata is usually forgotten, or it is only in the textual references or theoretical reference whenever we will go with the Vata Vyadhis. Always we will start with Pakshagata or some other Vata Vyadhis, and we will deal with only those things, and we will forget Gata Vyadhis and their treatment. So here I had thought that I'll put on a light with the Gata Vyadhis. What is it? What is Gata Vata? How we can interpret and treat in a clinical practice. So firstly, Gata Vata is nothing but it is Sthana Vishesha Vata Vyadhi. So Sthana Vishesha Vata Vyadhi means the Vata gets prakopa due to Nidana Sevana, and it goes and occupies, or the Kavaigunyata or Stoto Dushti will be taking place in a particular sthana such as Koshta, it may be Sarvanga, it may be Pakvashaya or anything else. So detailing on that, the Gata Vata Vyadhis has been taken up here. Moving into types of Gata Vyadhis, there are many types such as according to Bhava Prakasha, it is 16 types. According to Charaka, it is 14. According to Sushruta, it is 14. Gada Nigraha says it is 14 types. Ashtanga-Hridaya and Yogaratnakara says 13 types. It is different authors put different efforts to take Gata Vyadhis and explain their interpretation, and also they had put focus on many aspects like follows. Moving into individual Gata Vatas, the first Gata Vata which has been explained is Koshta Gata Vata. So here we can divide the Vata or Gata Vatas into three aspects. One is Ashaya Gata Vata, one is Dhatu Gata Vata, one more we can go with the Upadhatu Gata Vata. It is just division for an understanding purpose. The first Ashaya Gata Vata which I will be dealing is Koshta Gata Vata. So the Lakshana goes like Tatra Koshta तत्र कोष्ठाश्रितः दुष्टेः निग्रहो मूत्रवर्चसोः भद्र रुद्रोगगुल्माशः श्वासशूलं च मारुतेः. So what happens here? It is almost a textual reference what I am taking from Charaka Chikitsa 28 chapter 24th shloka. Here due to Nidana Sevana, the sthana samshaya of Vata takes place in Koshta Pradesha, leading to retention of urine and feces, swelling in Vankshana Pradesha, cardiac elements and other associated elements leading to epigastric and intestinal discomforts, various kinds of abdominal inflammatory conditions, swellings, lumps and tumors, hemorrhoids and pain in axillary region or rib cage or flank. So how exactly we can understand this Koshta Gata Vata in the clinical practices? See, Koshta refers to the all the angas from the zipisternum up to the pubic symphysis if I want to tell anatomically. So I can interpret this Koshtagata Vata in two ways. One is here there may be chance of Panchavata Vaigunyata due to Vimarga Gamana of the Vata dosha. Moving into Mutra, Vacha Nigraha and Ashyas, the Apana Vata Vaigunyata takes place. Bhradna, Gulma, Pashva Shula, the Samana Vata, Vyana Vata and Apana Vata Vaigunyata takes place. And in case of Hridroga, Pranavata, Vyanavata, Vaigunyata takes place. So it is little tricky to treat Koshtagata Vata in a Chikitsa aspect. So also second concept can be of Avarana. It is Anyonya Avarana. It is one subtype of Vata obstructing the other subtype, leading to Sangha and Vimarga Gamana Samprapti. So the Chikitsa goes like Sharapana, other treatments such as Deepana, Pachana, that is Koshtage, Kshara, Churna, Dyaha, Hanti, Pachana, Deepana, Ashtanga Dhyakara states like that. Charakacharya states that Visheshatasta Koshtastehe, Vate Ksharam Piben Naraha. So why Kshara has been emphasized in Koshtagata Vata is one more interpretation. So always Kshara Dravyas have Pachana Deepana effects. For example, practically we can take Shivakshara Pachana Churna, Shankha Basma as such in case of Koshtagata Vata. So in this aspect, we had treated few cases where a few patients had complaints of severe pain in an abdomen, whereas all the abdominal investigations has been ruled out, and even the modern medicines has been started treating it as acidity or epigastritis. So but there was no much relief. We started with Shivakshara Pachana Churna, one pinch with warm water, 2 TID, and along with Hingvadivati and Shankha Basma Prayoga, behind we had got a tremendous results. Even for Deepana Pachana, we can take Hingvasaka Churna, Matulanga Swaratsa or Kritamishita Anna Sevana at a home level practice. Even the Bhava Prakasha has been emphasized, especially in case of Koshtagata Vata as Kshira Prayoga. Even the Samskrita Kshirapana or Kevala Kshirapana is Deepana Pachana in yoga, and it is Vatahara. So that has been emphasized here. Next, moving into Amashayagata Vata. So here what happens is Pranabhi Todaha, Pashva Udara Ruk, Trishnaha, Udgaraha, Visuchikaha, Kasa Kantasa Shoshasya Shwasaha. So how this can be understood when there is Amashayagata Vata? Always we will get it out. Amashaya, why Pranabhi Pashva Udara Ruk? So it is like Ruja in specific sthana may be due to two aspects. One is Matruja Bhava and Kaphasthana. Trin, Nabhi, Pashva, Udara, and these all have a similarity embryologically by means of Matruja Bhava, and all these are Kaphasthanas. That can be interpretation. Second is Trishnaha. So Amashya is predominantly Kapasthana. We all know that. Due to Nidana Sevana, what happens here? The Rukshadi Guna Vriddhi of Vata happens. So the Prakupita Vata enters the Amashya, does Shoshana of Kapha in Amashya, and also in other near Sthana, which in turn does Pitta Prakopa, leading to Trishna. The third is Udgara. Due to Nidana Sevana, Vimarga Gamana of Vata takes place. Impairment in Gati of Vata leads to Udgara. The next line of symptom is Visuchika. Here the Prakupita Vata amalgamates with the Ama, and Prakupita Kappadosha in Amashya leads to Visuchika, which leads to Avarnajanya Samprapti. Next is Kasa, Kanthasya Shosha and Shwasa. Especially the Amashya and Uras again Kapasthana, Vata Prakopa and Kapasthana, Kasadi Lakshanopatti. Usually these symptoms always gives a question in our mind that what is the connection between Amashaya, Hrit, Navi, Parshva, Udara, etc. This may be the interpretation for these things. And the treatment goes like Amashayasthe Shuddhyastha Yata Dosha Harikriyaha. So what dosha has been predominantly affected, that dosha should be eliminated according to Acharya Charaka. So if the Kapha dosha has been more predominantly there, then Vamana can be interpreted, and if it is Pitta dosha, then Virechana. After Vamana, special prayoga has been explained by Acharya Sukshrita, that is Shadharana Yoga Prayoga, which we will tremendously use in practice. That is Shadharana Yoga Prayoga with Ushna Jala for 7 days. Then even the other acharyas such as Ashtanga Hridayacharyas explains Vachani Prayoga or Shadharana Yoga Prayoga. Then after proper Agni Sandukshana, then Kevala Vata Chikitsa has to be adopted. So different means of treatment has been interpreted. Overall, Amashaya Gata Vata can be tackled in 2 ways. One is by means of Dosha Harana. After the Dosha Harana, then Vata Shamana by means of Dipana Pachana and Vata Hara Dravyas. Shadharana Yoga Prayoga has been taken tremendously, give good results in case of Amashayagata Vata. Then moving into third Ashayagata Vata, that is Pakvashayagata Vata. So what happens in Pakvashayagata Vata? Pakvashayastu Antra Pujanam Shulatopau Karoticha Kritra Mutra Purishatvam Anaham Trika Vedanam. It is quite normal interpretation, that is Pakvashaya iti Athara Budaha. So we can take from small intestine, large intestine up to sigmoid colon anatomically. So here there will be Vimarga Gamana and Sangha Samprapti of the Vata, where mainly the Apana Vata Vaigunya will be taking place. So even the other acharyas stresses about Ashmari, Vardhma and Asha conditions in case of Pakvashaya Gata Vata. The Chikitsa is Buddha Pakvashaya Stetu Karma Udavarta Nuthitam. So Udavarta Hari Kriya should be adopted. So mainly in case of Pakvashaya Gata Vata, we had adopted Gandharva Hastadi Taila or Nimbamritadi Erenda Taila Prayoga has been done, and cases has been treated. Even the Shodhana Basti has been planned by means of Erenda Muladi Niroha Basti, Dasham Muladi Niroha Basti, and even the Lavanottara, that is increasing the Lavana quantity, we had advised Basti, and internally Hingvashaka Churna Prayoga has been done in case of Pakvashaya Gata Vata practically. The third Ashaya Gata Vata is Buddha Gata Vata. So here the Pakvashaya Gata Vata and Buddha Gata Vata has been separately emphasized because Acharya Chakrapani comments that the Buddha Gata Vata is Urdhva Buddha and Pakvashaya is Adhara Buddha. So what happens here again? Raho Vinmutra Vatanam Shuladmanashma Sharkaram Janghor Trikapat Prishta Roga Shosho Buddhasthitehe. The same Vedana Sevana happens, and due to Vata Prakopa, there will be retention of urine, feces, flatus, colicky pain. The main interpretation here is again the Apana Vata Vaigunya, nothing specific in this. The Chikitsa says that Karma Udavarta Nuditam, same treatment line of has been adopted. The next Ashaya Gata is Indriya Gata Vata. Clinically, we had not tried much about it, but the Lakshanas is based on the Indriya Vaigunyata, where the Vata gets affiliated, that Indriya Nasha will be there or Indriya Karmakshaya will be there, and the specific Chikitsa depends on which Indriya the Vata gets affected. So nothing much cases has been treated by me as such in case of this Urdhva Chaturagata Roga aspects. Next is Bastigata Vata. Here also the Apana Vata Vaigunya will be there, and the same Udavarta Nuditam Kriya has been adopted as usual. Then moving into Dhata Gata Vatas, which usually we will come across in clinical practice. The first is Rasagata Vata or Tvagata Vata. So what happens here? Tvagruksha Spudita Suptaha Krishna Krischa Tadudyataha Atamyate Saragascha Parvaru Tvaksthite Anile. So usually in case of many Tvak Vikaras, we'll go with direct diagnosis or differential diagnosis such as Eka Kushtha, Kitiba, or by means of Kinakara Spashatva, etc. While we will usually neglect this Tvagga, which have almost similar cases, or we can see similar persons with all these effects. That is Tvagrukshata, Tvaksputana, Tvakvaivarnyata by means of Krishnadi, then even there will be Saragaha. So the Gata Vata along with the Kushtha Samprapti can be interpreted and can be treated by means. The line of treatment is Svedha Abhyanga Avagahascha. That is Svedana, Abhyanga and Avagaha can be planned by means of different patients or different individuals, and Hrityam Chanam Tvagashite. So here mainly the Yoga Ratnakara explains about Rasagata Vata and he tell about Hridya Anna Sevanam. So even the Dalhana comments that as Chakarana Hridya Annapanaha, so Hridya Annapana should be given in case of Tvagata Vata. Then moving into Raktagata Vataha, Rujas Tivraha Sasantapaha Vaivarnyam Prishata Ruchihi Gatre Charumshi Bhuktasyaha Rakta Asragate Anidehe. So here again the interpretation usually we will get confused like how Rakta giving to severe pain, raising temperature, various discoloration, emaciation, anorexia, and so on. The first is Tivra Ruja. Maybe we can interpret it as the Upadhatu of Rakta Dhatu is Snayu and Kandara. So by means of this, there may be Tivra Ruja, for example, ligament tear, there will be severe pain. Then Santapa, Vaivanya, and Gatre Charumshi, maybe because of Rakta Prakopa. Then Aruchi can be interpreted in two ways. Like Rakta Prakopa, there will be Jala Mahabhuta Vriddhi, again Agni Mahabhuta Kshaya, leading to Aruchi. Or Ashaya Ashayi Bhava, Rakta Prakopa leads to Pitta Prakopa, where there is Vidagdha Jayanata. Then Bhuktasya Stambhaha. So what is this Bhuktasya Stambhaha? It may be the quantitative or qualitative hamperment of the Rakta Dhatu which causes this Bhuktasya Stambhaha as such. Then moving into treatment, it is quite normal that is Shita Pradeha Raktaste Vireko Rakta Mokshanam. So Shita Pradeha should be given as Daha is the main line of treatment. Virechana should be adopted and Rakta Mokshana can be adopted. Even this has been treated tremendously by giving the Mahamanjishta Dikashaya, TTSP, TID, Octa food along with Chandanasava and Manjishta Rakta Chandanadi Lepa Prayoga in the patient with this symptoms. Then moving into Mamsamedo Gatavata, the Lakshana is Gurvangam Tudyate Atyartham Dandamushti Hatam Krataha Sarukshamitam Atyartham Mamsamedo Gate Anilehe. So what happens here in case of Mamsamedo Gatavata? There will be Guruta in the Angatas. Then there will be different types of pain where a person specially explains that the pain is like a fist blow. That will be very painful, very severe in nature. But Acharya Sushruta and Bhagavata differentiate between Mamsagata Vata and Medogata Vata, telling in case of Mamsagata Vata, there will be painful nodular formation with a broad base, with Kapha and also the treatment is based on the same principle, that is Kapakshayaha. That is Mamsa Medovata Samane Api Lakshehe Vividashita Pitiyoktehe Vishishta Dhatu Lakshanai Visheshaha Unneyaha. So even in Mamsa Medovata Vata, as in Vividashita Pitiya Adhyaya, Vishesha Lakshanas has been mentioned. Similarly, the treatment will be explained as such. So Vireko Mamsa Medastehe Niruha Shamananicha. So here mainly the Niruha Basti and Shamana Chikitsa will be adopted in case of Mamsa Medogata Vata. So muchly we will be seeing the muscular pains. Even the patient will be having the Mamsa Medogata Vata Lakshanas. Many times the Basti Prayoga has been given very tremendous effects along with the Gugulu Prayoga such as Yogaraja Gugulu and so on. Then Majjastigata Vata. So the main Lakshana in case of Majjastigata Vata is Bhedo Asti Parvanam Sandishulaha Mamsa Palakshayaha Asvapnaha Santatarupcha Majjasti Kupito Anilahi. So here there will be Bheda, that is different kinds of pain or cutting type of pain in Asti, Parva and Sandhi. There will be Mamsa Palakshaya and Asvapnaha. So here we had undertaking a case on Majjastigata Vata. I'll explain in detail because it is ongoing case now and tremendously result has been coming for us. A male patient of 58 years who is a driver from Bangalore itself complains of Bala and Karmakshaya in both hands and legs. There is no, since 2 months, but there is no associated symptoms or anything specifically. Moving into the history of a present illness, he is a known case of diabetes mellitus since 15 years, hypertensive since 2 years, and he was asymptomatic before 3 months ago. He was absolutely normal. But on Jan 8th, that is, patient suffered, initially started with loose motions, for which he took some modern medication such as L-Dopa, and the symptoms got reduced. But what happened afterwards? The patient started with severe tiredness in the body for 1 week, but he neglected it, thinking that it may be due to the loose stools. And suddenly one day he fell, and when he fell, he noticed low backache and loss of strength in the lower limb, even the upper limb, and the next day it started increasing. He consulted many allopathic physicians, underwent physiotherapy, many treatment has been put on, but the weakness was gradually increasing. It will be day by day. And the MRI report suggested of mild ischemic changes with mild generalized cerebral atrophy. At last, he consulted neurologist but couldn't find any much relief, so he came to our hospital for better treatment. So there is no history of difficulty in swallowing, speaking, or fever. That is negative history. So nothing surgical history was there, but trauma before 3 months as he fell down due to tiredness and weakness. Nothing much contributory ahara vihara nidanas are there to this patient. Almost all the vitals are normal, and the neurologist suggested it is a MRI scan, and at last he diagnosed it as a GB syndrome, and it has been told there is no treatment for the syndrome at all. Looking into the Lakshana, the patient specifically had the Astimajjagata Vata Lakshana, that is Gurvangam, Bhedo Asti Parvanam. There was Bhedo Asti Parva was there, Sandhi Shula was there, Mamsa Balakshaya was evident in the patient, and the patient couldn't able to sleep for 3 months. He was completely disturbed sleep was present. So moving to systemic examinations, almost all the systemic examinations were normal. That is, respiratory was quite okay, cardiovascular was quite okay, even the gastrointestinal. But moving into CNS, he was conscious, oriented to time, place, person. The tone is hypotonic, both upper limb and lower limb. The coordination of movements were normal. The reflexes were under normal limits, superficial, but deep reflexes were diminished. Cranial nerves were absolutely intact, and there were no involuntary movements. Based on all these things, the treatment plan has been made by considering three Vyavachedaka Nidanas. One is Kaphavrita Vata, one is Kaphavrita Vyana, Astimajjagata Vata, and diagnosed as Astimajjagata Vata. The treatment plan, that is the treatment principle for Astimajjagata Vata, is Bahyascha Abhyantaraha Snehaihi Astimajjagatam Jayet. So Bahya Snehana and Abhyantara Snehana is Chikitsa Siddhanta. Considering this Chikitsa Siddhanta, treatments were started. Initially, it was Sarvanga Udvartana with Kolakulathadi Chuda because stiffness was present. Then Dhanyamla Parishika has been done for 2 days. Afterwards, shifted to Sarvanga Abhyanga with Mahanarayana Taila, followed by Bashpa Sveda. And even in the middle, we started with Patrapinda Sveda and Shashtika Shalipinda Sveda. And planned for Talam, with Amalaki, Bala, Guduchi, Rasna, Chona, 10 grams each. And the Basti schedule has been done, that is Kala Basti schedule with Ashwagandha Dhita as a main aspect, and Rajayapana Basti, that is Kshirapaka, has been made by means of Rajayapana Basti Kalka, and then it has been used. After 15 days, there was tremendously increase in strength in both the limbs. But I am not telling it has got completely cured, but we are seeing improvement in the patient day by day. Soon after the Basti, it was the first observation what was done was that strength in both hands were improved and patient was satisfactory. This is the understanding of Gata Vata, where we will always neglect or we will forget that the concept itself. So next the Vata is about Shukragata Vata. That is almost same the Shukragata Vata, where there is Vata Prakopa leading to different deformities in Shukra, that is either early premature ejaculation or retention of semen, fetus, various deformations of Shukra. Also, the Garbha has been mentioned because Shukra is present in both male and female. So, preterm or delayed labor, miscarriage, intrauterine death. The interpretation is mainly based on Apanavata Vaigunya, and Chikitsa says that Basti should be adopted, especially Kshira Basti along with Harshana. When there is Vibhatta Margata and Shukra, first Virechana should be adopted, then Shukrakara Anapana should be adopted. No much practical utility in this. Then moving to Upadhatu Gatavatas, where we will be seeing n number of cases as Snayu Gatavata, Sandhi Gatavata especially, and in few cases the Sira Gatavata. So moving to Snayu Gatavata, that is Bhakya Bhyantara Ayama Kalli Kubjat Kamevacha Sarvang Ekanga Rogascha Snayu Gatanila is according to Charakracharya, where Sushitaracharya particularly tells that Snayu Asti Shudaha. So there will be Stambhaha, Snayu Uparantehe, Shramaha, Brahmaha, so Shulaha, Kampaha. So there will be Stamba, Kampa, Shula in case of this affected area. One clinical example we can take here is Snayu Gatavata, tennis elbow syndrome, where there is affected to the Snayu, the pain and the inflammation. So especially the Purpara Sandhi Gata Marma will be getting affected, whereas the Snayu also will be getting affected in this condition, whereas tennis elbow clinically or practically doesn't have any treatment as such. They have NSAIDs. If that fails, they'll go for Mills manure. If that fails, again, they'll go for surgical treatment. And many new treatments are coming, such as extracorporeal wave therapy and all, but still there is no useful or 100% treatable condition is that. Even that can be taken in the concept of Snayu Gatavata and Sandhi Gatavata and can be treated tremendously, and we are treating many conditions based on this principle. The principle is Snehopanaha Vinikarma Bandhana Mardhanani Cha Snayu Sandhesti Samprapte Kudyad Vayuvava Tanditaha. So even the Sira Gatavata rarely we will see in clinical practice, where there is Shariram Mandar Yukshopaha Shoshiyanti Spandate Tataha. So there will be mild body ache, mild swelling, emaciation, excessive pulsation, or loss of diminished pulsations, etc. And moving to Sandhigata, it is quite common condition, that is Vatapurna Ritispasha Shota Sandhigate Anilehe Prasarana Akunchanayoho Pravrittishasa Vedanaha. So Sandhigata Vata, I think all of our physicians will be facing this complaint at least 10 cases per day, and Ayurveda have a tremendous effect clinically, where by means of Sneha Upanaha Avnikarma, many drugs can be adopted based on a what is that individual approach towards us. Recently, I had got a patient of female who is 69 years of age, where there is bilateral knee joint pain, and the MRI scan suggests a bit of osteoporosis with osteoarthritic changes, where they told the replacement therapy is the final option, and the surgery was not opted to that age, but they told forcefully to go for surgery, then the correction may be there. At last, they doesn't want to go for surgery and approached us. Within the 2 days of treatment, that is Basti, Janu Basti and Kati Basti, Eranda Muradi Basti has been adopted. She can able to walk within 2 days, where she was not able to move her leg at all. That is the mesmerizing concept of Gatavatas, where always we will forget the small topic in an entire big topic of Vatavya this. But if we really stress upon this Gatavatas and adopt in our clinical practice, we can treat a number of cases by 100% result, and we can tell by means of Ayurveda there is a cure, obviously, and many will be having misconcept till today. I don't know about in few parts of India, but many parts of India, even in our place, they won't accept our science, and they'll always have a misconcept. It is slow. It will get cured very slowly, and maybe there is no side effects at all and all, but it is not so. Understanding of each and every concept without leaving its importance plays a vital role in treating many conditions. So here I wind up telling that the concept of Gatavata is very much essential to understand, to interpret, and to apply it clinically, and we can treat patients by means of Ayurvedic treatments. Thank you. So it is open for discussion now.
Thank you very much, ma'am, for taking your time to prepare for such an extraordinary, enlightening session, which was incredibly informative. We will now go ahead to the question and answer session. Shall we begin, ma'am?
Yes, sure.
Delegates, please post your questions in the chat box.
Delegates, please post your questions in the chat box. Ma'am, there is a question in chat box.
And can Gata Vata affect on Kala, Gata Vata, Tatavata Kala, Gata Vata, Kala, like that? So the question is very nice. Sometimes the Gatavatas will reach up to the Kala level also. I'm not sure about that. In clinical practices, we had seen reaching this Gatavata into the Kala and more than that. So yeah, it will have surely effect on Kalas also. But not exactly that Koshagata Vata and Pittadara Kala or Majjagata Vata and Majjadara Kala, not like that. It depends on what extent of Nidana Sevana has been takes place and the Kavaigumnita has been takes place. Based on that, the Uttarottara dhatus will be affected initially, then it will reach to the Kala depending on the severity of the nature. Here in case of GB syndrome, almost the cellular metabolism has been hampered where we can tell the Kala has been affected.
Thank you,
I
ma'am.
think Dr. Polika got clear answer.
Yes, ma'am, I got cleared.
Okay. So, yeah, good evening, Dr. Gautam. The Shamanaushadhi we can use in Gatavata. So, individual Gatavata will be having different Shamanaushadhis. For example, as I said in Kosha Gatavata, we can go with Hivashtaka Churna or Shankha Basma. If there is Pachana Dipana is needed along with the Vata Shamana. In case of Majasti Gatavata, where we had opted here as Gandharva Hastadi Taila for Anulomana and different Basti Prayogas. Like that, each and every Gatavata, the Shamana Aushadhis can be different. We can't generalize this Shamana Aushadhi for this Gatavata as such. So, 6-year-old child drags his right foot on examination. There is no specific finding. Both legs measurement is equal. During ANC period, mother had vomiting till delivery. Preterm birth weight was 950 gm. NICU admission for 1 month. Okay. So, Dr. Savita, what you wanted from me about this case?
Dr. Savita, ma'am.
I'm not sure about the diagnosis, madam, because what happened in the term or in ANC period, I don't know the exact history. And till now, I had not put any light on children. Only I will be concentrating on adults. But this, based on the symptom, we can consider it as initially the Mamsamedo Gatavata, and that line of treatment can be adopted if there is no consanguinity and all the things should be ruled out, that such as diabetes mellitus, hypertension or hypothyroidism during the delivery or any such issues should be ruled out, then it can be considered under Gatavata and can be treated, madam. But I'm not sure about this since complete history is not available.
Ma'am.
Okay. In case of Pandu, first initially we should start from Gata Vata, because there are two interpretations in kinds of Pandu where Acharya Charaka emphasized on Rasadi, but Acharya Sushruta in one concept I'll focus on Rakta Dhatu. So here initially we have to take the Rasa Dhatu Gata, then we have to move with Rakta Dhatu Gata rather than Majja Gata Vata. That will be the best line of treatment in case of Pandu in the initial stages. Once it reaches the final stages where all the Lakshanas are there and it attains the Bahudosha Avastha, then we can consider the later on Dhatu such as Majjagatavata.
Thank you, ma'am. Ma'am, a few questions are from YouTube, ma'am. Shall I read out?
Sure, sure.
One question from Dr. Samatha Tomar. Gata Vata diagnosis is possible in Amavata.
Sorry, I didn't get.
Whether Gata Vata diagnosis is possible in Amavata.
Gatavata diagnosis possible in Amavata. Actually, Amavata is a condition which has been emphasized by the later authors. It is Vatarakta, initially what the Acharya or the classical text refers it to. Of course, we can take the Tatavata concept in case of Vatarakta or Amavata, because there will be two kinds, that is Uttana and Gambhira. Even in case of Amavata or Vatarakta, initially the affection will be towards the greater joints, then it will reach the minor joints, and the Dhatu Avastha has been explained. So there obviously we can take the Gatavata concept, but treatment should be adopted based on a yukti of a physician.
Thank you, ma'am. Another question is, what would be the line of treatment in case of Gata Vata?
Yeah, that's I had explained, I think, because in case of a specific Gatavata, we can go for specific line of treatment. For example, in case of Amashya Gatavata, Shadharana Yoga has been mentioned. In case of Koshta Gatavata, we can go with Shankhabhasma or Dipana Pasana Dravya such as Hingvashtaka Churna. In case of Mamsamedo Gatavata, we have to go with still Gugulu Prayogas. Like that, each individual Gatavata should be tackled, and then Shamanaushadhi and Shodhana has to be planned. That will be the best rather than generalizing. This is the treatment for Gatavata can't be done as such.
Thank you, ma'am. Another question is, ma'am, can you discuss diagnostic criteria for Sarvanga Gata Vata?
Sarvanga Kupite. So mainly the diagnostic criteria for Sarvanga Gatavata, first is clinical approach. What the patient will do, we have to examine the patient thoroughly, and then we have to think whether there is all the lakshanas which has been present in Sarvanga Gatavata, Sarvanga Kupite Vate Gatra Spurana Panchanehe Vedanabi Paritasya Spuranti Vase Sandeha, whether all these things are present, lakshanas should be taken in consideration. Then to assess this lakshana, we can go with systemic examinations, or specific diagnosis, we can go with MRI changes or CT changes. But what I ultimately go with is with the lakshanas present in the patient rather than any specific investigations or diagnostic tools. We can understand the diagnostic tools, interpret it in by means of Ayurveda, and then it can be tackled up.
Thank you, ma'am. Delegates, you can ask questions by raising the hands. Ma'am, there is no more questions, ma'am. Shall we wind up the session, ma'am?
Yeah, sure.
Thank you very much, ma'am.
I request Dr. Tulya Mohandas ma'am, Vice Principal, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Good evening, everyone.
Before that,
Yes,
excuse
ma'am.
me, ma'am. Can I just? Yeah, before that, I thank Dr. Tulya Madam and Diksha Ayurvedalaya to provide me this opportunity. In this moment, I really remember my one of the Guru, Dr. Keshav sir. Because of him, I got this opportunity. Thank you, ma'am.
Yes, ma'am. Good evening, everyone. On behalf of DIKSHA E-Learning and Ayurveda College, Coimbatore, I extend my gratitude to Saujanya ma'am, who actually immediately accepted my request. As she told, uh, when I requested sir, he immediately suggested madam's name. And I thank madam once again to be with us and to give us a wonderful session. I thank all the audience for gathering here and being a part of this. Thank you, one and all.
Thank you, ma'am.
Thank you, ma'am. It's the province of knowledge to speak, and it's the privilege of wisdom to listen. Thank you all for the patient listening and the valuable time spent. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought provoking knowledge. Thank you all for joining us. Thank you.